Millions of Americans have experienced a serious mental illness, such as schizophrenia, bipolar disorder, or major depressive disorder. However, the current system of care is fragmented, disconnected, and often inadequate, with few advances to meet current needs, causing many to go without the necessary support.
Despite all of the advancements in mental health care, the current system of care is extremely fragmented. There's very little data sharing between inpatient, more intensive outpatient programs, and long-term therapy. So there has traditionally been a lack of using kind of technology and innovation in mental health. Lately, there's a huge number of apps out there to help people with their mental health. But in general, these are technologies that aim to help people with mild to moderate symptoms. People with serious mental illness, they need more in-person care, wraparound care.
Unlike so many other areas in healthcare, the mental health space has been late to introduce technology. With poor information sharing, the highly disjointed landscape requires patients to repeat the same traumatic story to countless providers, often keeping them from obtaining care altogether.
Families struggle, patients struggle with initially the stigma of severe mental illness, reaching out for help, talking to people. They enter systems that are often scary and fragmented. There's a lack of connection between the family, often the physicians, clinicians treating the patients on the inpatient unit. Discharge plans are made often without incorporating family members, and sort of the plan is to just get patients into and out of care quickly. And so often when patients get discharged from an inpatient unit, it's kind of like, let's cross our fingers and hope they land somewhere. If patients don't show up to traditional appointments, they don't show up and they're a no-show. Patients with SMI, patients with serious mental illness, really lack insight often into their illness and need for care.
While highly manageable, when left untreated, people with severe mental illness experience 2 to 3 times higher mortality rates and die up to 20 years earlier than the general population.
So serious mental illness is correlated with substance use and oftentimes comes hand in hand. It's not always clear what's first. What's most important is that people receive care for whatever condition or conditions they have. And so oftentimes someone may land in the hospital because of their psychiatric condition, might need higher level or more acute services at that time, and then gradually, as they improve, can be stepped down to levels of care. And so it's about following someone throughout the course of their condition to ensure that recovery is sustained.
Now, developments in technology and innovation provide a unique opportunity to improve the standard of care for severe mental illness.
What we do here at Amae is take care of patients holistically, both their mental and physical health. So we try to treat everyone. We measure this using different technology to understand how is somebody improving or getting worse. We see our patients about 500 hours in person. That is an extremely large data set that we are getting, and we're getting it longitudinally. And that really is one of the benefits of using AI, is to leverage the information that we're gathering to try to find symptoms to help improve on, to try to find patterns that we can use so we can get patients better faster.
One of the things we're really focused on is leveraging all the advantages of data and technology to really innovate in serious mental health. The other place where we're using technology is we're starting to use precision medicine approaches that use things like fitness trackers to collect this great data that tell us important information about sleep and activity. So that's one of our big focuses here, is to how do we leverage all this data, collect good, high quality data all in one place, and then start using it to guide treatment.
The initial phase offers a more intensive approach, focusing on stabilizing an individual via outpatient programming, concentrated on data-driven, integrated whole-person care.
Amae's holistic way brings together all the different disciplines that are necessary in order for somebody to be able to prosper and thrive. And that goes into the mental with our psychiatrists and therapists, the physical with health coaches, dietitians, and primary care. They're managing sleep, exercise, nutrition, all the concrete behavior changes that need to happen to bring stability to mind. And then lastly, the social. What is the community element, the peer supports, people that you can really trust and engage with and feel safe with.
Rather than offering intensive but short-term programming, the care model focuses on building a lifelong partnership. Members receive the tools and resources needed to enable long-term recovery, as well as a community of support and peer mentorship, helping them to transition into a maintenance phase over time.
We focus on wrapping our members around with people and support and community, and doing so in a really authentic way so that they know that they're coming into a safe place with people that they can trust and depend on. We also incorporate families into this piece so that everybody can be on the same page over treatment plan progressions and next steps. We really focus on the purpose and meaning angle and ensure that our long-term care model is incorporating in life goals that help people re-engage in schooling, go back to work, or establish authentic community engagements and relationships.
In the future, developments in artificial intelligence, cutting-edge technology, and clinical research will continue to raise the standard of care and push the field of mental health forward.
One of the best use cases of AI is how do you find patterns in a deep data set where we can actually create standardization of how we prescribe. So then when a member sees a psychiatrist and they might look similar to somebody else that we've seen 2 years ago, we're not starting from blank slate.
Partnerships with academic medical centers is extremely important to really advancing care. But the reality is they're really not built to scale all of these technologies. So for example, someone may come up with a new therapy or technique to use with a depressed individual, but then that thing may be really helpful for other individuals with serious mental illness, but no one does the work to adapt it. So the most important scaling is really using things like value-based care to be able to scale out all of these innovative treatments to the vast majority of individuals that right now just don't have access to it.